we're losing a generation of young people, mainly due to HIV/AIDS. Death from AIDS is not a simple, I get AIDS, I die. Research has shown that there's at least 90 days of severe pain for over 80% of people with HIV. This not only affects the patient, it affects all of those around them who are caring for them. There's the effect of having to care with somebody whose suffering can very easily be ameliorated with palliative care drugs.
And finally now, I'm nursing patients that have been told that they have incurable diseases. It is quite a different field and fairly difficult field, because most of the patients, including their families, are at their vulnerable stage when they know that the condition they have is incurable. It is quite difficult for the health professional, because you then have to deal with all their problems from the time they started being ill, hoping that they will be cured, and now you have to tell them that this is an incurable disease. On the other hand, it is quite a fulfilling job in that you know for a fact that even though the disease is incurable, you as a health professional are going to do everything in your power to care for all symptoms that can arise and make their life much more easier to cope with.
We've been able to show that it's affordable. We've been able to show that it's cost effective. We've been able to show that it rationalizes entrance into hospital. If we're able to care for people at home in an affordable way. It's not a luxury. Palliative care is actually not a luxury. It makes good economic sense, good health economic sense, and good humanitarian sense. 80% of people with cancer present too late for cure in this country. But that doesn't mean too late to care. And we can look after and provide care for all of those people if we had the resources. And that's what this centre is really about, finding appropriate care that is cost-effective, that is affordable for South Africa. And we've made lots of inroads in that. We want to make sure that it's not just left to the poor looking after the destitute, or the well-off looking after the well-off. It's a government responsibility. The government understand that well enough, that they must look after the most vulnerable sector of their society, which are people who are dying. And everybody deserves access to pain relief, and everybody deserves access to symptom relief. People understand, patients understand that their illnesses advance. They understand that the medical science, won't be able to cure them. But there is hope in the sense that we can provide a good quality of life for the remainder of their life living. Palliative care is quite a new area of healthcare in South Africa. And up to now, traditionally, the government hasn't provided it as a routine service, even though the government has said that there should be palliative care. And doctors haven't been trained on how to look after people with severe pain. Doctors haven't been trained on how to tell people they're dying, and they haven't been trained to really deal with the thousands upon thousands of people who have severe pains and symptoms. So what we are doing here is really bringing that aspect of care, which is a human right, and in South Africa is in our constitution. It is in the government policy, and we're just realizing that for the thousands of people in South Africa that require it. So that we decided to set up the first government-led service to test it out at this hospital, and really use this hospital as a training ground for other healthcare facility and for healthcare workers across the country. As a support is needed for more research, more training, more service delivery pilots, so we can see how to get antiretrovirals, better ways of doing care, especially in rural areas. And so that this centre can really become alive and work to its full capacity. The centre has the potential to deliver a lot of palliative care research and training very quickly. It needs that assistance now.